Let's go further into individual patient-centered considerations regarding peptide regimens. There's going to be individual variability, as I mentioned, with each patient and their physiological states. This might result in them having different receptor expression levels, meaning actually more or less receptors, or they might be more or less sensitive. There's going to be differences in their signaling cascades and the intensity and duration because they're different physiological states. They're going to have different goals. One might be metabolic system oriented, another endocrine, another recovery system oriented, or some other system based focus objective. There's going to be different comfortability with dosage routes. Many peptides, because of those inherent short biological half-lives and durations, require daily administration. Everyone might not be okay with a daily injection. So it's important to consider if there might be an alternative delivery method available to a peptide to facilitate a patient's adherence and comfort. And then when it comes to response interpretations, uh, again, there might not be a lab value that you can actually pull to objectively measure how well the peptide is working. So the assessment needs to be based on a functional response actually seen by the provider and the patient. So in all, it's important to keep in mind that all these limits in the information we know about peptides and these individual patient variabilities require a very individualized dosing, a very individualized formulation, a very individualized administration, and a very individualized assessment of each patient.